Welcome to this educational video. This video has been developed by MedNav. MedNav is an organisation that helps promote women's and children's healthcare through innovation and education. If you'd like to know more about us or indeed support our work, then please visit this link below. We've developed this video to help you understand what Placenta Accrete Spectrum is. We'll explain how it affects you and your baby, and we'll also share some stories of how this condition may affect you and your pregnancy.
A normal placenta grows inside the uterus. It connects you to your baby and provides food and oxygen for your baby to grow. A normal placenta can grow anywhere in the upper part of the uterus and attaches to the endometrium, which is the lining of the uterus. After birth, the placenta should detach by itself and deliver after your baby. A placenta can be abnormal in either its position or how deeply it attaches to the uterus. If the placenta is too low, it is called a placenta praevia. If the placenta attaches too deeply, it is called Placenta Accreta Spectrum, or PAS. It is also known as abnormally invasive placenta. There are three different types of Placenta Accreta Spectrum. An accreta is when the placenta attaches to the muscle of the uterus. An increta is when the placenta grows into the muscle of the uterus. And a percreta is when the placenta grows through the muscle of the uterus and can sometimes grow into nearby organs such as the bladder. The placenta does not always attach uniformly, so some areas can attach more deeply than others.
Placenta accreta is not common. It occurs in approximately 1 in 2,000 patients. It can happen to anyone, and we will describe what risk factors are common in this condition.
My name is Shanyan Koda. I was told that I was expecting twin girls earlier this year. This was very exciting news for us as a family. We already have 3 daughters, so to be expecting 2 more was extremely exciting. Unfortunately, in my 3rd trimester, I was diagnosed with placenta accreta. This caused quite a lot of anxiety, but the twins were born in August and they're now 16 weeks and healthy. There was a lot of uncertainty, I remember, in the weeks leading up to the birth as to whether my placenta was stuck to my uterus, and I had to go through a lot of scans from various different specialists in the placenta field. But after multiple scans, there was the pregnancy scan, there was the 4D scan, there was the MRI scan. I don't think it was conclusive as to whether my placenta was stuck or not.
Major risk factors for Placenta Accreta Spectrum include previous Placenta Accreta Spectrum, previous caesarean section, previous trachelectomy, which is when your cervix has been removed, suspected scar ectopic in this pregnancy, placenta praevia in this pregnancy.
My name is Sarah. My little boy Jonah was born in July 2020 at 36 weeks. Initially, I was diagnosed with placenta praevia at my 20-week scan. As the pregnancy progressed, I had more scans and an MRI, and they confirmed it was possibly placenta accreta. During the operation, they found it was actually placenta increta, with the placenta having completely invaded the uterus and pushing up against the bladder wall. It was a challenging pregnancy for me, as for a long time there was very little information, very little in terms of the diagnosis. But once I was transferred into the care of the high-risk team, I was able to sit down with my doctor and discuss the diagnosis in more detail.
If we suspect you have a Placenta Accreta Spectrum, you will need a caesarean section to deliver your baby safely. If your placenta doesn't attach at the time of the caesarean, then we will use different surgical techniques in order to deal with this. Often, however, the safest way to deal with this is to remove your uterus or to perform a hysterectomy in order to minimize the risk of bleeding.
I was definitely very anxious and quite scared about the prospect of losing an important organ. I knew the rationale behind the hysterectomy. If the doctors couldn't remove my placenta from my uterus, or if I had bled too severely, then they would perform a hysterectomy in order to save my life. But that didn't change the fact that I was very anxious and very scared to potentially lose an important organ in my body.
The main complication of this form of surgery is excessive bleeding. Planning your surgery beforehand will help to minimize this. It is likely that you will need a blood transfusion, and normally we do not remove the ovaries at the time of the operation, so you should not go into the menopause directly following this operation.
It was difficult to hear. It was a big shock. I hadn't really received any information about my diagnosis at that point. So it made me realise the severity of the situation. I really didn't want to lose my uterus, but having had time to digest the situation, I knew that my doctor would do absolutely what was necessary for Jonah's safety, for my safety. My priority was to get through the birth, to be there for my family, and I knew that my doctor and I were on the same page with that.
We will make every effort to prepare you for your surgery, and we will discuss the different steps involved. You may need a hysterectomy or removal of the womb, and you will also need a specialised team to look after you during the surgery. This will involve doctors, nurses, and midwives to deal with this very complex surgery.
In certain circumstances, where a small amount of the placenta is abnormally attached to your uterus, it may be possible to only remove the affected uterus instead of having a hysterectomy. If a less extensive surgery is expected, it may be possible for you to be awake with pain relief similar to an epidural instead of a general anaesthetic.
Very occasionally during your surgery, we may decide to leave the placenta inside, especially if it's attached to organs outside of the womb. After your surgery, we will then discuss with you about the different options, which include conservative management, which is essentially leaving the placenta inside, or doing a hysterectomy at a later date.
There are serious risks associated with conservative treatment, which include infection, bleeding, emergency hysterectomy in up to 3 out of 10 women. Therefore, it is important to have regular monitoring for up to 1 year whilst your placenta is being reabsorbed. Your doctor is likely to perform a cystoscopy to see if your bladder is affected by your placenta. This is where a camera is passed into your bladder through the urethra, which is where you pass urine. Often your doctor may decide to place catheters, which are small tubes, into your ureters, which are the tubes that connect the kidneys to the bladder. This can help prevent damage to your ureters during the operation. The cystoscopy is done just before your caesarean section, and a urinary catheter is placed into your bladder to protect it.
During your operation, we may find that the placenta is attached to your bladder. If this happens, we will need to open your bladder in order to remove the placenta safely, and this will mean you will need a catheter for 10 to 14 days in order for your bladder to heal.
It did cause me a lot of anxiety during that time. Not knowing what would happen is very anxious, and I suppose I just trusted my doctor to make the right decision and told myself a lot of positive affirmations that everything was going to be okay, and the babies were going to be okay.
The treatments that are offered to you will depend on what's available locally. In many countries around the world where access to health professionals and blood transfusions are limited, the chances of needing a hysterectomy are higher.
It is normal that your doctor will recommend the birth of your baby by a planned caesarean section at no more than 34 to 35 weeks. While this may be a few weeks earlier than your due date, there is good chance that the baby will stay with you and will not need special care baby unit. We can optimize the lungs and the brain of your baby by administering steroids and magnesium sulfate. However, if you experience any bleeding, it is necessary that you go to the hospital immediately.
So the night before I was due to go in for the operation, I started bleeding significantly and was rushed to hospital. It was a horribly traumatic time. I didn't have a chance to say goodbye to my little 18-month-old boy. Had to rush out of the apartment. It was a very worrying time all round. But on arrival at the hospital, all the teams were there waiting for me, reassured me very quickly that everything with Jonah was still absolutely fine and got me into theatre quickly. I was so relieved to see my doctor. I was awake for the first part of the procedure, but it became obvious that the placenta had done too much damage, and my doctor advised me that he would have to put me to sleep. He delivered Jonah, performed a hysterectomy and a blood transfusion, having lost 6 litres of blood. Jonah spent 2 days in the NICU, 5 days in special care, and he spent then the last 2 days with me before we were allowed to go home together.
When I was 34 weeks pregnant, I started to bleed suddenly and significantly in the middle of the night and was rushed into hospital. Luckily, the bleeding settled when I was in the hospital, and I was able to wait till my planned surgery date. The doctors kept me in hospital for the last couple of days just to keep me under observation, and we were very relieved, all of us, I think, that we made it to the planned surgery date. When the babies were born, my first twin had some trouble breathing, so she needed some help in the neonatal intensive care unit. But my second twin, Rosie, was fine. She stayed with me from birth.
If you experience significant bleeding, it may be necessary to perform the cesarean section immediately, and your baby will be born prematurely. The younger your baby is, the more likely that they will need to stay in the special care baby unit. Recovery period can significantly vary, and it's usually dependent on your operation. It may be necessary to be monitored for a period of time in the intensive treatment unit. However, the majority of women will be monitored in a high dependency unit on the delivery suite. The recovery after pregnancy can take time, so be kind to yourself.
My recovery was definitely a lot longer than what I remember from my previous C-sections. I remember the pain was a lot worse, and the wound itself took a lot longer to heal. In terms of mental and emotional recovery, it took me a long time, and to be honest, it's still happening now, 16 weeks later, and I'm still digesting what happened during my pregnancy. So I found it very helpful that I found somebody on Instagram who had the same experience, and we were able to share our experiences.
It was pretty brutal, incredibly painful. The internal healing took a long time. I also developed a condition called ileus, which made it all the more challenging for me. The scar takes quite a bit of getting used to, but considering the size, mine healed really nicely. My experience was during COVID times, so no visitors were allowed. I actually wasn't really up to seeing people, but I missed my little boy terribly, my little boy at home. I was away from my baby. It was hard. So it was a difficult time. It was a lonely time. Going home was amazing, to be together again as a family. But it was also the start of processing the trauma that happened that night, some PTSD. It's been a difficult journey emotionally and mentally, but I could not be more grateful for what my doctor and his teams did for me.
If you still have a uterus, it is necessary to have a careful discussion with your obstetrician on contraception and future pregnancies, as up to 3 women in 10 can be affected by Placenta Accreta Spectrum in future pregnancies.
I would say ask as many questions to your doctor as you can. There are no silly questions. The more prepared you can be before the procedure, the calmer you're going to feel. Let your friends and family know that you're going to be going through something significant so that they can provide support for you afterwards. And when the procedure is over, allow yourself to feel whatever it is you need to feel. I didn't, and it delayed my recovery. I felt guilty for a long time that I shouldn't be feeling the way I was feeling, that I shouldn't be struggling. I'd got through it, had my baby, he was doing really well, but it's okay to admit that you're struggling and that you've been through something really, really traumatic. I would get a support network together, whether it be friends, family, a counsellor, a Facebook group, all of the above, because it's going to be really important to you for when you have some shaky moments.
It's a difficult pregnancy and it will cause a lot of anxiety. But I would say just focus on the positives and try not to dwell on the negatives. If you're reading the internet, try to read a reliable source, because there are lots of sources out there, and be honest to your feelings. I think once you acknowledge that you're anxious, you're nervous, and you're scared, it's almost easier to process these feelings than denying them. And I think you will get through to the other end easier as well.
There's no doubt that Placenta Accrete Spectrum is a complicated condition to have in pregnancy, and sometimes it can be overwhelming. The important thing is to seek care from specialised medical professionals, but also to seek support from your friends and family.